person cannot have good general health without good oral health. That was a quote stated by the former Surgeon General in 2000, C. Everett Koop. Periodontal medicine is a field of oral health that is currently doing research to describe the relationship between oral and systemic health. It has been linked to diabetes, heart disease, preterm low birth weight, and respiratory disease. To better understand the link, I'm now going to explain what periodontal disease is. Periodontal disease is a bacterial infection of the gums and bones surrounding the teeth. Periodontal disease that is limited to inflammation is called gingivitis. Gingivitis is reversible, and as you can see in this picture, the gums are slightly inflamed and they may bleed when you brush. Periodontal disease that involves the gums and the bone is called periodontitis, and it results in permanent destruction of the bone and tissue. As you can see in this picture, you're slowly starting to lose some bone support, and as it progresses, it eventually leads to tooth loss, and it is the #1 cause of tooth loss in adults. The primary etiology of periodontal disease is gram-negative bacteria that forms below the gum line. While the primary etiology is bacteria, risk factors or conditions or habits that also modify the body's response are systemic, which includes smoking, heredity, medications, diabetes, and hormone alterations, or local environmental factors, which include the presence of tartar, the shape of the tooth or the morphology, trauma, habits such as holding a toothpick between your teeth, mouth breathing, or tongue thrusting. To prevent periodontal disease, you want to be sure to brush your teeth 2 times a day, floss at least once a day, and to get a professional cleaning 2 times a year. Now you know about periodontal disease, I'm going to explain how it is related to your overall systemic health. It is important to know that about 40% of Americans have severe chronic periodontal disease. It is related to diabetes in that it increases the severity, leading to retinopathy, nephropathy, cardiovascular disease, neuropathy, and poor wound healing. There was a study done by the Pima Indians, and it proved this study. Cardiovascular disease is also related to oral health, in that the infection that leads to plaque in arteries is the same that is found in your mouth. Your mouth is a gateway to systemic cardiovascular circulation. Coronary heart disease increases by 20% when you have periodontal disease. It also leads to preterm low birth weight babies. There's a 7-fold increase in women who have periodontal disease compared to women who don't in having preterm low birth weight babies. And oral pathogens release toxins that reach the placenta, affecting fetal growth and development. And infections should be treated before the woman becomes pregnant to avoid this problem. The last systemic condition that periodontal disease is related to is respiratory health. Breathing periobacteria can cause aspiration pneumonia and can lead to respiratory infections, and it is especially important in elderly that live in long-term care facilities to maintain their oral health, because they tend to have more respiratory issues. Periodontal disease leads to systemic health problems. Systemic conditions are complex, and they have many risk factors, including periodontal disease. Periodontal disease is easily prevented by brushing, flossing, and visiting your dentist regularly. You can find more information on www.perio.org.